Welcome, everyone. When you injure your knee, hip, low back, wherever, one of the first questions you may be asking yourself is, should I be using ice or heat to treat my injury? I used to get this wrong all the time, and it honestly slowed down my recovery more than once. So today I want to discuss with you how I use both and when for my own hip and knee injury recovery, because not only do I have a hip labral tear, but more recently, as of a few months ago, I also got a meniscus tear on my left knee. So this works with different types of injuries. So let's get into it. Now, the first thing to understand is that ice and heat are not enemies. They both have their own purpose. Ice helps reduce inflammation and calm things down, while heat improves blood flow and helps tissues relax. The key is knowing when to use each one. When my hip injury was fresh, and even more recently with my knee swelling, ice was an absolute lifesaver in reducing and managing my inflammation. If something is swollen, irritated, or just feels hot, ice is usually the way to go. It brings things down so you're not feeding more irritation to that area. But here is where people get stuck. They keep icing forever. Once the swelling goes down and things aren't as inflamed anymore, ice doesn't help you progress. That's when heat becomes your best friend, especially for knee pain, hip tightness, and deep low back tension. For me, heat is now something I use on a daily basis. It is very versatile as it can be used to help warm up the muscles and tissues before exercise, which always makes movement smoother for me. It could also be used at night before bed to help aid in relaxation and reduce pain, which especially helped me in those rough, agonizing nights in the beginning of my hip injury where falling asleep comfortably almost felt near impossible. Here's what I look out for. If I have a fresh injury and something is swollen and irritated, I go with ice. If something is tight, locked up, or stiff, I go with heat. If I'm unsure, I go with heat either way because usually my problem is tightness and not inflammation. And these are some things to remember. Always use some sort of barrier between the ice and your skin, like a towel, and never directly apply ice to your skin. Keep ice sessions around 10 to 15 minutes long. Heat is great before exercise, movement, and sleep. Ice is great when you push too far and feel irritated. And lastly, when you're icing, always elevate the injury above your heart if possible for the best icing results. It is these simple rules that cleared up so much confusion for me. And honestly, it isn't even about being perfect. I still use ice and heat on a weekly basis depending on how my hip, knee, or low back feels. Recovery is definitely not a linear process. It's about responding to what your body needs in the moment, and that can vary day by day. And now I will show you how this all looks like in practice using my left knee that is injured. So before I ice my knee, what I'm gonna wanna do is grab a fresh cold ice pack from the freezer and a towel to cover it with. Then before I lay down, I need something like a pillow of some sorts to prop up the injured area, which in this case would be my left knee, and something else to prop up my head like this yoga block here. So once I got a good setup here and I'm laying down, I get the ice pack, make sure the towel is touching the skin and not the ice pack itself, lay down, and once I'm comfortable enough, I put a timer on for about 10 to 15 minutes, and that's all you have to do. This is how you would ice any sort of injury that you have. Now let's get into how applying heat therapy would look like, once again using my left knee. There are many different heat gels, liniments, and balms you could use, but any sort of heat topical you have available to you is more than enough. Once I get a good amount of this heat liniment I have here onto my hands, I'm gonna rub it into the injured area for about half a minute, really making sure I work it into my knee and the surrounding areas. So once this is all nice and applied, for the last step, which I highly recommend, is that you use some sort of sleeve or brace, something that's comfortable enough for you to still move in, but that helps reinforce and provide compression for the injury. So this is after I applied my heat topical. Put that over my injured area, which is my left knee, and done. You're good to go. That is how applying heat therapy would look like to your injury. So if you've been confused on whether to ice or heat, simply remember this. Ice calms things down, heat helps things move, and using the right one at the right time is what matters most in your recovery. So if you're dealing with your own injury right now, hips, knees, low back, stick around. I'm sharing everything that's helped me so you don't have to guess. If this gave you any clarity, comment, like, subscribe, and thank you for your time.